Good evening, doctors and viewers. Good evening, doctors and viewers. My name is Rahul Desai, and I hereby welcome you all to this fifth episode of 52 Weeks Diabetes Essentials with Padma Shri Dr. KK Agarwal. The way Dr. KK Agarwal has given insights on metabolic syndrome, insulin resistance, chronic inflammation causing diabetes is actually a paradigm shift in an approach towards the treating diabetes from now on. And this episode, which we are taking today, will also provide much more insights on further ahead. Before I proceed ahead, I would hereby take the pleasure of announcing the winners of the quiz session for the last episode. Before I announce the winners, the questions for the last session were: which of the following statement below given is correct? 1. Immune cells like macrophages infiltrate pancreatic tissues, releasing pro inflammatory molecules in diabetic individuals. Both circulating and cellular biomarkers underscore that diabetes is a chronic inflammatory disease. B. Chronic complications linked to diabetes include only microvascular complications. C. Diabetes does not affect the cardiovascular system. And the answer was option A. The second question was following signs which of the following are the signs of dehydration? Options were headache, irritability, tiredness, and all of the above. And the answer is all of the above. So you will be surprised that our session of this online modules of 52 weeks is gaining momentum and success throughout day by day as this information is being reached all across to all your colleagues and peers throughout the country. And happy to announce for the last session, there are almost 53 winners from all over the country. I'll just quickly take the names of all the winners. From Delhi, we have Dr. Prachi Garg, Dr. Suresh Mittal, Dr. Vinod Ladia, Dr. PC Pahwa, Dr. Subir Majumdar, Dr. Praveen Kumar Sharma, Dr. Sadhna Sharma, Dr. Batra. From Haryana, we have Dr. IC Garg. From Jammu Kashmir, we have Dr. Shahid Sofi. From Uttar Pradesh, we have Dr. Sumit Garg, Dr. Sanjay Mehrotra, Dr. Ashwini Kumar, Dr. Shoaib Ali, Dr. Surjit Kalsi, Dr. Sanjeev Mishra. Coming to the west of India, from Gujarat, we have Dr. Dhirendra Sanindya, Dr. C.F. Shah, Dr. Vijay Mehta. From Maharashtra, we have the long list of winners: Dr. Jayant Maru, Dr. Girish Gesota, Dr. Anupam Agarwal, Dr. Damodar Jeswani, Dr. Meena Chincholikar, Dr. Shanti Narayanan, Dr. Kulbhushan Tandon, Dr. Dharmika Tandon, Dr. Jagruti Dabuwala, Dr. Pratap Parkar, Dr. Kamlesh Jariwala, Dr. Chandrasekhar Barve, Dr. Sushma Wale, Dr. Vasant Kumar Banushali, Dr. Dakshyani Menon, Dr. Shashikant Shende, Dr. Sanjeev Desai, Dr. Jayashree Salian, Dr. Vinita Shetty, Dr. Bharat Jain, Dr. Seema Shah, Dr. Nitin Patil, Dr. Shreyasri Mahere, Dr. Harsh Shah, Dr. Rajesh Bijlani. From MP, we have Dr. Z. Lodhi. From Karnataka, we have Dr. Chandrasekhar. From Tamil Nadu, we have Dr. Venkateshan Natarajan. From Andhra Pradesh, we have Dr. Adi Narayanan. From Jharkhand, we have Dr. S.S. Rana, Dr. Arsad Razi, Dr. Gautam Datta. And final, from Dr. West Bengal, we have Dr. Shantanu Kumar Bhattacharya. So I hereby congratulate all the winners of the quiz session of the last episode. I know you all are very eager to listen to Dr. KK Agarwal. So without taking much of the time, I hereby hand over the platform to Dr. KK Agarwal, sir. Thank you.
Thank you, Rahulji. Thank you, FDC, for organizing this series of lectures, and which is going to continue for the next 52 weeks. And this is our fifth in a row. From now onwards, whenever we present The next lecture, we will also talk about the glimpses of the last lectures so that we are in continuation with what we have taught in the past. And if you are listening carefully for these 20 minutes, there is no reason that you will also not be a winner for the prizes we are offering. Today, we are going to talk about a simple subject, and that's clinical presentation of diabetes. If I want to finish this lecture into 1 minute, I can finish by saying diabetes, adult type 2 diabetes. I'm focusing for the first few lectures on adult diabetes. In children, we will have special sessions later on. Pregnancy and children, we will have special lectures which will focus to children and in pregnancy. So in a non-pregnant adult person, I can finish today's lecture by saying that diabetes is a silent disease. That means there are no symptoms of diabetes. In 50% of the cases, it can remain silent. And whatever we hear, polydipsia, polyphagia, and polyuria, is uncommon. Therefore, my lecture now has to be a lateral thinking in understanding diabetes. When I know it remains asymptomatic, then how do I pick up a diabetes? That's going to be my subject today, which will basically deal with how to pick up diabetes in a clinical setting where it can remain asymptomatic. So it is a series of diabetic essentials, 52 weeks with Dr. K.K. Agarwal. And today's presentation is on clinical presentation of diabetes. Of late, now this talk will also summarize what we have learned so far, glimpses of that. So there has been a paradigm shift. We used to think diabetes means sugar in the urine. Today, we know even SGLT2 inhibitor can cause sugar in the urine. So sugar in the urine is no more a criteria. Then we started saying accidental detection of sugar in the blood means diabetes. Then we come back to abdominal circumference, blood pressure, and cholesterol. Then we came back to macro and microvascular complications, then associated risk factors, then meta profile, and that meta inflammation. So therefore, now we are looking for diagnosis of diabetes in a different perspective, as diabetes can remain silent, like lipids can remain silent, blood pressure is a silent disease, obesity is a silent disease, metabolic syndrome is a silent disease, insulin resistance is a silent disease, and CRP 1 to 10 as a low-grade systemic inflammation is a silent disease. So how do I suspect diabetes today or tomorrow? If you get a child who is obese at age 7, start looking for diabetes in the family, as this child is going to remain obese and going to develop diabetes in future. So as a pediatrician, if I have a child at age 7, he's coming with obesity, I should ask them, I hope your parents are not diabetic. Your elder brother is not diabetic. So if there is an obesity at age 7, means either this child is going to become diabetic in future, or his parents may be diabetic asymptomatic. So if I ask an adolescent, and if the adolescent says my weight gain after the age of 20 is 10 kg in the next 1 month, I will ask them, do you have a similar lifestyle disorder in your family? Maybe somebody, your elder brother or your elder sister, already has developed diabetes. So if I get a female who says I'm gaining weight after menopause, look for a delayed onset diabetes in them. If a tailor says that 50% of my people, my customers have abdominal circumference more than half of the height, 33% of them may end up into diabetes. If a person is snorer, obstructive sleep apnea, neck circumference is more than half of abdominal circumference, that means more than 40 centimeter, look for diabetes in them. These are indirect markers of diabetes because directly they may not be any symptoms. Acanthosis nigricans. The barber says that the neck is black. There are small particles, small tags, maybe diabetics. Altered immunity. Somebody says, I have recurrent boils in my body. That indicates altered innate immunity, means the person may be diabetic. If a person has signs of metabolic syndrome or insulin resistance, look for diabetes. If you find a CRP more than 1, the person has low-grade systemic inflammation. Immediately you find out the person may have a diabetes or a pre-diabetes. An elderly patient comes to you with tuberculosis. How can an elderly have a type 4 type of a immunological reaction without diabetes? Look for diabetes. A patient develops COVID-19, look for diabetes. Every COVID-19 rule out diabetes. If a person has hypertension, obesity, and dyslipidemia, they are coincidentally may have along with that a diabetes. So patient may come to you only with hypertension. He is not telling you any symptoms of diabetes. And if you don't detect diabetes, the only manifestation may be a coincidental presence with hypertension, obesity, and dyslipidemia. If a person comes to you with a cancer of liver, pancreas, endometrium, colon, rectum, breast, and bladder, this may be the only indication of diabetes. So a diabetic patient may present with a breast cancer. These are called coincidental cancer. Comorbid conditions, hearing impairment, sleep apnea, fatty liver disease, periodontal disease, cognitive impairment, depression, eating disorder, anxiety, fractures, they all may be associated with diabetes. Dental, when we say a dental periodontal disease, even without teeth, with or without inflammation, pre-operative evaluation, you may find large number of them have diabetes. And if the parents are diabetic, even if you are asymptomatic, you may be diabetic. Now you understand that even if diabetes is silent, there are indirect markers of diabetes. It may not be symptomatic, but there are indirect markers. This slide needs to be saved by all of you because all of you might have done hundreds of mistakes in your life, missing diagnosis of diabetes in these situations. This is the slide which I have shown you 2 times in the past. This is diabetes. A barber and a tailor should be able to detect diabetes. These are the patients who will go to a skin specialist. And the skin specialist may not pick up diabetes because he will treat it like a tag, like a skin tag. He will say, let me do the laser. A person getting a blackening of the skin in the armpit may never go back to the doctor, may never go back. A blackening on his elbow, he may not go to the doctor to show what it is. He may be thinking that it is normal for him. So these are the patients where the diagnosis is obvious, but you don't even inform the doctor. So what we classically think is that a patient will present with polyuria, polydipsia, nocturia, blurring vision, and weight loss. But this is not the commonest manifestation. This will only happen when the sugar is more than 180. That means if you have moderate to severe uncontrolled diabetes, then only these symptoms will come. And by the time it is too late, by the time you have polyuria, polydipsia, and nocturia, it means 5 years you have delayed and you have already developed microvascular complications. So therefore, 50% of the time patient is asymptomatic and he presents with either accidental blood sugar level or a concurrent illness, or if you are a good doctor, you pick up in these situations, you anticipate and pick up. So think of diabetes, anticipate diabetes and pick it here than to wait for it to become symptomatic or getting detected accidentally. If the diabetes is 5-year old, it has already developed macrovascular and microvascular complications. So some people will present with acute MI, erectile dysfunction, peripheral vascular disease, or CVA. And you find that 30% of them may have underlying diabetes, which you have missed. You say recent onset diabetes or a chronic diabetes. So after 5 years, it takes 5 years for you to develop macrovascular or microvascular complications. Somebody may present with compromised kidney as a microvascular nephropathy. Patient already came with microalbuminuria. Patient may have eye vision disorders. Patient may have neuropathy. Patient may have foot ulcers. But by the time the patient presents with macro or microvascular symptoms, 5 years are delayed. Therefore, I don't want to waste my 5 years in diagnosing a diabetes after 5 years. Therefore, I would like to pick up diabetic at this particular stage. Some people will present with autonomic nervous system. They may say, I have gastric. All those patients who are taking pantoprazole with the domperidone, and they say, I am on pantoprazole with the domperidone because I get lots of burping or nausea or reflex esophagitis, actually maybe having a diabetic gastroparesis, and they are missing the diabetes there. And why they are missing the diabetes there? They are diabetic maybe postprandial. So for example, in COVID, the diabetes is postprandial. And if you do only fasting sugar, you will miss it. If it is a steroid-induced diabetes, you will miss it. Most of the time, diabetes is missed because you don't anticipate. If a patient has postural hypotension, postural patient has blood pressure fall, postural tachycardia, autonomic dysfunction. If a person says, I walk for 1 minute and my tachycardia increases, all features may be a diabetic autonomic neuropathy, and you are missing a diabetes because you have not done HbA1c. Some people will present with innate immunity. That means they will directly present with septicemia. Some people will present with hyperosmolar non-ketoacidotic coma or diabetic ketoacidosis, usually when they have a superadded infection. And now we have a new target that if the patient you do a CRP is more than 1, which is a sign of low-grade systemic inflammation, you say chini chawal maida CRP more than 1 or ghee tel makhan CRP more than 1. Chini chawal maida CRP more than 1 means the patient has diabetes. These are the patients who will have visceral obesity leading to diabetes. And then another presentation may be that you are totally asymptomatic, but you have metabolic syndrome. That means your abdominal circumference is more than half of the height. Your triglyceride is more than 150. Your HDL is less than 40 or 50. Your BP is more than 130, 85. Fasting sugar is more than 100. So these are the patients who are in metabolic syndrome, who are going to develop diabetes in the coming years, and you miss them because these patients may present only with a fasting sugar of more than 100 or a BP of more than 130 by 85. Or your patient may present with insulin resistance, which means fasting sugar of more than 10, which is asymptomatic. So if you are getting a patient with high sugar levels but not diabetic, the patient may be insulin resistant. And we have already talked about that if the CRP is more than 0.65, rule out pre-diabetes in them. Now, some people may present with hyperglycemia non-diabetic. That means you check, the patient comes to you with fever, you check they have high sugar, HbA1c is normal. That means this is a hyperglycemia of a recent onset. Now, this may end up into a diabetes. This is not diabetes at this moment, but it may become diabetic in 1 year's time. If your hyperglycemia is less than 140, there are 7% chances of becoming diabetic. If it is less than 200, 18% becoming diabetic. And if it is more than 200, 50% will become diabetic within 1 year. So some people may present only with stress hyperglycemia. Now, these are some people may present with diabetes because you suspect them because of antibodies. That means a patient have lean body status, a patient have continuing weight loss and ketonuria. In all such cases, you start looking for diabetes as a presentation. Overweight or obese adolescent or young adult presenting with apparent type 2 diabetes who actually may have an early presentation of type 1 diabetes. Type 1 diabetics, we will take it separately, but here I say that type 1 diabetes in adults may present with diabetic ketoacidotic coma in 25% of them. Now I want to spend some time again. So I want to go back to this slide, which is the most important. So age 7 obesity, weight gain after age 20, weight gain after menopause, abdominal circumference more than half of height, high neck circumference, acanthosis nigricans, altered immunity, presence of metabolic syndrome, presence of insulin resistance, low-grade systemic inflammation, elderly patient developing TB, developing COVID-19. If you have hypertension, obesity, dyslipidemia, look for incidental diabetes. If you have cancers, look for diabetes. If you have comorbid conditions, rule out diabetes. And then preoperative evaluation, rule out diabetes. And the parents are diabetic, rule out diabetes. Now I want to devote again in those cases where patient is asymptomatic, sugar is coming out to be normal or borderline, and you want to know whether this patient who is pre-diabetic, metabolic syndrome or insulin resistance, before he become diabetic, will he develop a heart attack or not? And that is decided by underlying inflammation. So all those cases who are pre-diabetic, if their CRP is more than 0.65, these are the people where macrovascular disease has started. And that's what I want to spend 5 minutes into it. So low-grade systemic inflammation, and these can be now a different other types of presentations of diabetics. So when the low-grade systemic cytokine inflammation starts, it starts in the visceral adipose white cells. That cells become obese, they go into stress, they produces interleukins. So therefore, if you are checking a patient and if his TNF alpha is high or IL-6 is high, which is now becoming a routine test, rule out diabetes in such situations. So therefore, If a patient has high TNF alpha, or it shows a macrophage 1 response, which we will talk, or there are markers of meta-inflammation, rule out diabetes. Now this, if I go back to this, diabetes adipose tissue will have simultaneously M1 activation in liver, skeletal muscle, pancreas, and adipose tissue. Therefore, if a patient has fatty liver with a CRP of more than 2, take it for granted he is diabetic. Even if the blood reports are not showing, these patients may have diabetic complications if you evaluate them. Now, skeletal muscle is now a new thing. If a person comes to you कि खाना खाने के बाद में मेरे को weakness लगती है, तो if you eat food, you should feel energetic, like drinking Enerzal Zero, which is what I'm comparing it as. So you are supposed to feel energetic after eating food. But after eating food, if you say I'm feeling weak, that's diabetes. And if you say that my abdomen is going into abdominal circumference is increasing, but my muscle mass is reducing, that is called sarcopenia. And now sarcopenia is a sign of metabolic syndrome. For me, metabolic syndrome is a situation or a type of diabetes when the micro and macrovascular complications start. If you diagnose a diabetic, once the symptoms have started, 5 years are over and micro and macrovascular complications have set in. So today I want to emphasize, if you want to prevent macro and microvascular complications, you need to pick up diabetes 5 years earlier than the symptoms, for which one of the new phenomena is sarcopenia, syndrome associated with muscle and metabolic function, characterized by reduced muscle strength and physical activity. कोई आदमी अगर ये कहता है मैं चल नहीं पाता, चलने से सांस फूलता है, मेरे को मैं नीचे बैठ के ऊपर खड़ा नहीं हो सकता, मेरे घुटनों में दर्द हो रहा है, this is all sarcopenia. So today, if a person has early osteoarthritis of the knee, rule out diabetes. Kaise? The thigh muscles will become weak and his joint will give way. So reduce muscle strengthening now. And now, what is the treatment of diabetes? Muscle strengthening exercises. If you make sarcopenia disappear, metabolic syndrome will disappear. People give more importance to diet. I'm giving more importance to muscle weakness. So if you have muscle weakness, you exercise, carry Energal Zero with you. Carry Energal Zero with you because it doesn't have calories. This contains electrolytes. So the treatment of diabetes 5 years earlier is jogging, walking, and weightlifting exercises, not followed with sugary drinks. And if you want to have a hydration, you should have a 0 caloric fluid along with electrolytes to cover. So skeletal muscle is the message of the day today. So we have been learning a paradigm shift. In the paradigm shift, we are talking about involvement of liver. Everybody has fatty liver. 37% people have fatty liver, but people are not correlating that fatty liver has the same metabolism in the body, inflammation, which can also linked with diabetic vascular complications. Skeletal muscle, we have been ignoring all the time. Remember, skeletal muscle has M1 macrophages. It has white adipose cells. Chronic inflammation leads to sarcopenia. And obviously in the pancreas, if your inflammation continues in the pancreas, then beta cell destruction occurs, and you are converting a reversible diabetes into irreversible diabetes. Somebody says, is diabetic reversible? I says lifestyle diabetes are reversible, but if you are not managing your inflammation and there is a chronic pancreatitis, and because of that you end up into a pancreatic beta cell destruction, these are the patients where you may end up a type 2 diabetics now requiring insulin. So if you want, if your patients, normally we say after 10 years, everybody needs insulin. No, I don't agree with you today. That was a statement of the past. Today, if you treat diabetes along with inflammation, that means you give anti-diabetics and you also take care of the inflammation, you may permanently avoid a patient going into insulin. So let me revise again that diabetes is a silent disease. Majority of the time you need to anticipate, and high degree of suspicion is the answer. Mistakes will happen because in some cases, in every case, you will not do HbA1c. If you are only following fasting sugar, people may have a postprandial hyperglycemia. Some people, the blood sugar may be not in the diabetic range. That means it will be less than 126. For me, they are diabetic. For me, metabolic syndrome is diabetes. For me, insulin resistance is diabetic. Why? Because macro and macro complication, vascular complication starts 5 years before the diabetes becomes asymptomatic. That's all for today. Let's go to the questions of the week. We have two questions. Now, this measure does not help to prevent diabetic complications. Remember, we are talking about preventing diabetic complications, which may take 5 years to develop, controlling blood lipids and blood pressure, prompt detection of diabetic eye and kidney disease, eliminating all carbohydrates from the diet, and controlling your blood sugar. Your answers should start coming now. I'll give you 30 seconds to answer, then I'll go to the second question. Answer your query now. And the second question is, working out when it is hot and muggy can cause serious dehydration as quickly as 30 minutes, 40 minutes, 1 hour, and 2 hours. Therefore, whenever you are working out, carry Energal Zero with you. Specifically, if you are working out for more than 30 minutes, 40 minutes, 60 minutes, 120 minutes. And if you develop severe, serious rehydration, Energal Zero will be able to save your life and rehydration and kidney involvement. With that, let's go to Rahulji. Let me see if there are questions of the people here. I'll pick up few questions. Thank you, Arpit ji. Is dapagliflozin 10 milligram a better option for type 2 diabetic patients? So Arpit ji, DAPA, D for diabetes, D for DAPA, आप याद रखिए that DAPA is helpful for diabetes. This will increase sugar in the urine, so therefore do not rely on the urine test. Once you start taking DAPA, it may help in reducing your heart disease, and it may also reduce your diabetic nephropathy. So today, because we say diagnosis of diabetes is done 5 years, by the time you have a symptomatic diabetes, you already have a nephropathy or a retinopathy. Therefore, DAPA is going to be the future drug. Now it is available in India. Therefore, it is going to become a drug of choice. So remember, D for diabetes, D for DAPA. Yes, Narendra Yadav ji बोल रहे हैं, I am a high blood pressure patient and sugar patient and 56-year-old. Can I take the vaccine? The answer is yes. In fact, vaccine is made for people like you. Remember, the vaccine is made for people like you. That's what, because if you are not going to take vaccine, then who is going to? Anybody who has pre-diabetes, anybody who has metabolic syndrome, anybody who has a CRP more than one, they are at risk of getting complications because of the corona COVID-19. Remember, if you have COVID-19 or if you are going for a COVID-19 vaccine, if you have any of the presentations we have talked today, you can develop some complications. If you have underlying inflammation, even vaccine will prepare and will manifest overt inflammation into this. Over to Rahulji.
Thank you,
Yes,
sir, for today's wonderful session. And yes, it is another milestone in our journey towards this 52 episodes of Diabetes Essentials, Dr. KK Agarwal. I thank all the viewers in taking out time and marking their presence for today's important topic and important session. And also hereby I do appeal all the viewers to help us to connect all other colleagues of theirs who are yet to get connected for this important webinar series. Do spread this importance to your colleagues by word of mouth on your respective platforms on your local groups. Thank you so much. Thank you, Dr. KK Agarwal, sir. Thank you, all the viewers. Thank you. Good night. Bye.
thank you, Rahulji. The only message I want to give is anticipate, anticipate, and anticipate. If you have a high degree of suspicion, then only you will be able to save a life. Don't wait for clinical manifestations to occur. Thank you.